Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Ramsha Mushtaq Khan, and today I have the opportunity to present on the topic ventilation under the kind supervision of Professor Dr. Saira Afzal. Quote of the day: "The future belongs to those who believe in the beauty of their dreams." Content outline: Number 1, introduction and importance of ventilation. Number 2, innovations in ventilation. Number 3, best practices for ventilation in various settings. Number 4, emerging trends and technologies. Number 5, impact of COVID-19 on ventilation. Number 6, sustainability and climate change considerations, and recent advances and multiple choice questions. And yet, at the end of this presentation, the participants will be able to understand the importance of ventilation in maintaining indoor air quality, describe the different types of ventilation systems and their functions, identify the types of ventilation systems commonly used in different settings, and describe the corresponding best practices, and recognize the emerging trends and technologies in ventilation and their potential impact on public health and environmental sustainability. Ventilation implies the replacement of vitiated air with a supply of fresh outdoor air, and also the control of the quality of incoming air with regards to its temperature, humidity, and purity in order to provide a thermal environment that is comfortable and free from risk of infection. Poor indoor air quality can be up to 5 times worse than outdoor air. Ventilation is crucial to improve indoor air quality and protect public health. Importance of ventilation. Proper ventilation not only helps to prevent the spread of airborne diseases, but also reduces exposure to harmful pollutants and allergens that can trigger respiratory problems. The COVID-19 pandemic has brought to light the importance of ventilation in reducing the spread of the virus indoors. Proper ventilation can help remove contaminated air and reduce the risk of infection. By improving ventilation at workplaces, productivity is increased with a remarkable decrease in absenteeism due to illness and healthier and more comfortable living and working environments. Standards of ventilation. Based on efficiency of system and removal of body odor, there are 3 standards of ventilation. Number 1, cubic space. Number 2, air change. And number 3, floor space. Cubic space. Different workers have advocated standards for the minimal fresh air supply ranging from 300 to 3000 cubic feet per hour per person. The widely quoted standard is that of D. Schaumont, who advocated a fresh air supply of 3000 cubic feet per person per hour on the following grounds. Number 1, it was observed that so long as the amount of carbon dioxide due to respiration was not more than 2 parts in 10,000 parts of air, the air of the rooms seemed fresh and did not sensibly different from the outdoor air. Assuming that an average person expires 0.6 cubic feet of carbon dioxide per hour and that 0.0002 cubic feet of carbon dioxide in 1 cubic feet of air is the permissible impurity, it is calculated that 0.6 divided by 0.0002 or 3,000 cubic feet of air would be required by a man at rest per hour. This standard of ventilation, however, is no longer followed. Air change. It is now established that carbon dioxide theory is not correct because even if the carbon dioxide content of air is raised to over 5% and the oxygen content reduced to 18%, there were no deleterious effects so long as the cooling power of the air was satisfactory. Air change is much more important than the cubic space requirement. It is recommended that in the living rooms there should be 2 or 3 air changes in 1 hour, and in workrooms and assemblies, 4 to 6 air changes. If the air is changed more frequently, that is more than 6 times in 1 hour, it is likely to produce a draught, which should be avoided. Based on this concept, it is now considered that a space of 1000 to 1200 cubic feet per person is quite sufficient. The number of air changes per hour is calculated by dividing the total hourly air supply to the room by the cubic capacity of the room. Floor space. Floor space per person is even more important than cubic space. Heights in excess of 10 to 12 feet are ineffective from the point of view of ventilation, as the products of respiration tend to accumulate in the lower levels. Therefore, in calculating the cubic space requirements, heights over 10 to 12 feet are not taken into account. The optimal floor space requirements per person vary from 50 to 100 square feet. Types of ventilation. There are two types of ventilation. Number one is natural ventilation, and number two is the mechanical ventilation. There are three mechanisms for natural ventilation. Number one is wind, number two is diffusion, and number three is inequality of temperature. Wind. The wind is an active force in ventilation. When it blows through a room, it is called perflation. When there is an obstruction, it bypasses and exerts a suction action at its tail end. This is called aspiration. Doors and windows facing each other provide cross ventilation. Back-to-back houses do not permit cross ventilation, and therefore their construction is not allowed. Diffusion. Air passes through the smallest openings or spaces by diffusion. This is a slow process and therefore is not relied upon as the sole means of ventilation. Inequality of temperature. Air flows from high density to low density. It rises when slightly heated and escapes from openings provided high up in the room. The outside air, which is cooler and denser, will enter the room through inlets placed low. The greater the temperature difference between outside and inside air, the greater the velocity of the incoming air. In the tropics, the outside air may be hotter than the inside, and the reverse may take place. These properties of air are utilized to best advantage by the proper location of windows, doors, ventilators, and skylights. The chief drawback of natural ventilation is that it is not possible to regulate the velocity of the incoming air, nor to adjust its temperature or humidity. There are four mechanisms for mechanical ventilation. Number one is exhaust ventilation. Number two is plenum ventilation. Number three is balanced ventilation. And number four is air conditioning. Exhaust ventilation. In this system, the air is extracted or exhausted to the outside by exhaust fans, usually driven by electricity. As air is exhausted, a vacuum is created which induces fresh air to enter the room through windows, doors, and other inlets. Exhaust ventilation is generally provided in large halls and auditorium for the removal of vitiated air. The exhaust fans are housed in apertures in the external walls, high up near the roof, which facilitates the removal of the upper layers of the heated light air. The ventilation may be regulated by adjusting the speed of the fans. Local exhaust ventilation is widely used in industries to remove dust, fumes, and other concentrated contaminants at their source. Plenum ventilation. In this system, fresh air is blown into the room by centrifugal fans so as to create a positive pressure and displace the vitiated air. Plenum or propulsion system is used for supplying air to air-conditioned buildings and factories. Air is delivered through ducts at desired points. This system, however, is of limited utility. Balanced ventilation. This is a combination of the exhaust and plenum systems of ventilation. The blowing fan must balance the exhaust fan. When this system is employed, the natural system of ventilation is entirely dispensed with. Air conditioning. The simultaneous control of all or at least the first three of those factors affecting both the physical and chemical conditions of the room within any confined space or room, most of which affect in a greater or lesser degree the human health and comfort, is called air conditioning. These factors include temperature, humidity, air movement or distribution, dust and bacteria, and odors and toxic gases. Air conditioning is popular in large institutions, hospitals, industries, and dwellings. Its use in operation theaters is of particular value in the control of pathogenic organisms in the air. The air is filtered when drawn into an air conditioner system from the room. Excess humidity is removed and the air is circulated back into the room after heating or cooling it to bring the room temperature to the required comfort zone. Large institutions or hospitals often install central air conditioning systems for the entire building instead of installing equipment for individual rooms. Better controls and economy is achieved in central air conditioning. Transition room. Where the temperature difference is large between the outside atmosphere and the air-conditioned room, a transition room is sometimes provided, which maintains temperature in between the two so as to prevent sudden exposure to high or low temperature. Innovations in ventilation systems. Number one is smart ventilation systems, which are designed to adjust the ventilation rates based on occupancy and outdoor air quality, which can help reduce energy consumption while still maintaining good indoor air quality. Number two is advanced filtration technologies, which can help to remove airborne pollutants and improve indoor air quality. Some of the latest filtration technologies include high efficiency particulate air HEPA filters, electrostatic filters, and ultraviolet germicidal irradiation UVGI systems. High energy efficient ventilation systems, which are designed to reduce energy consumption while still providing good indoor air quality. Some of the latest energy efficient technologies include heat recovery ventilation HRV systems, demand control ventilation DCV systems, and natural ventilation systems. Indoor air quality monitoring and control systems, which are designed to provide real time monitoring of indoor air quality and control the ventilation rates based on the monitored data. These systems use sensors to monitor various indoor air quality parameters such as temperature, humidity, carbon dioxide, and volatile organic compounds. Emerging trends and technologies. Increasing use of smart ventilation systems that adjust ventilation rates based on occupancy and air quality, integration of ventilation systems with other building systems such as heating and cooling to improve energy efficiency, adoption of low emission building materials and furnishings to reduce indoor air pollution, development of innovative ventilation technologies such as thermally driven ventilation that use natural energy sources to power the system, increased use of natural ventilation systems that rely on passive strategies such as cross ventilation and stack effect. Impact of COVID-19 on ventilation. Increased awareness of the importance of ventilation in preventing the spread of airborne diseases, adoption of new guidelines and standards for ventilation in various settings such as healthcare facilities, schools, and public transportation. Use of portable air purifiers and UVC lights to supplement ventilation systems in high-risk settings. Research on the effectiveness of ventilation and air cleaning technologies in reducing the transmission of SARS-CoV-2 and other airborne pathogens. Exploration of the role of ventilation in promoting overall health and well-being beyond infectious disease control. Now it's time for the recent updates. WHO Roadmap on Ventilation, Roadmap to improve and ensure good indoor ventilation in the context of COVID-19 by World Health Organization. Executive Summary. The risk of getting COVID-19 is higher in crowded and inadequately ventilated spaces where infected people spend long periods of time together in close proximity. These environments are where the virus appears to spread by respiratory droplets or aerosols more efficiently, so taking precautions is even more important. Understanding and controlling building ventilation can improve the quality of the air we breathe and reduce the risk of indoor health concerns. Methods. The roadmap was developed after conducting a scoping review of the available literature and an assessment of the available guidance documents from the major internationally recognized authorities on building ventilation. This process considered infection prevention and control objectives, resource implications, values and preferences, ethics, and research gaps within the roadmap development. The process resulted in a roadmap on how to improve ventilation in indoor spaces. The finalized roadmap is divided into three settings. Number one is healthcare, number two is non-residential, and number three is residential spaces such as private houses. For each category, there is a further certification according to the ventilation system, that is mechanical or natural ventilation. After identifying the correct setting and ventilation system, the reader should start from the top, beginning with the central column labeled Step Key Questions. On the left side, the minimum requirements and standards are proposed for each key question, while on the right side, the different strategies to improve the specific matter is mentioned. Strategies are listed in order of preference from the most effective to the least effective. That is, if more than one strategy can be implemented, the one on the top should be preferred. As a rule of thumb, the strategies at the top of the list, while being the most effective, can be the most expensive and take the longest to implement. So this is the roadmap, pictorial representation of the roadmap of heating, ventilation, and air conditioning system divided into mechanical and natural, and the three settings: the healthcare setting, non-residential settings, and residential settings. So this is the roadmap for healthcare settings for natural ventilation. The step key question is, does the ventilation rate meet the WHO minimum requirements? The minimum requirements are 160 liters per second per patient. And the strategies include access the opening locations and opening surfaces considering potential new openings. Consider enabling cross ventilation rather than single-sided ventilation. If the system does not allow increasing ventilation to the recommended minimum per person requirement, consider reducing the maximum room occupancy to meet the liters per second per patient standard. If no other short-term strategy can be adopted, consider using a standalone air cleaner with HEPA filters. Now for the mechanical ventilation, the step key question is the same, the minimum requirement is the same, but the strategies include, in consultation with a heating, ventilation, and air conditioning professional, assess the opportunity to increase the ventilation rate according to system capabilities. If the ventilation rate cannot be increased mechanically, consider maximizing ventilation by using natural ventilation through opening windows. If the system does not allow increasing the ventilation to the recommended minimum per person requirement, consider reducing the maximum room occupancy to meet the liters per second per patient standard. If no other short-term strategy can be adopted, consider using a standalone air cleaner with HEPA filter. Towards sustainable, energy efficient and healthy ventilation strategies in buildings, a review. Energy demand has been increasing worldwide, and the building sector represents a large percentage of global energy consumption. Therefore, promoting high energy efficiency in buildings is essential. Among all building services, heating, ventilation, and air conditioning systems are significantly responsible for building energy use. In heating, ventilation, and air conditioning, ventilation is the key issue for providing suitable indoor air quality, while it is also responsible for energy consumption in buildings. Thus, improving ventilation system plays an important role not only in fostering energy efficiency in buildings, but also in providing better indoor climate for the occupants and decreasing the possibility of health issues in consequence. Besides energy efficient methods such as natural and hybrid ventilation strategies, occupants' behavior regarding ventilation can also affect the energy demand in buildings. Therefore, the influence of occupants' behavior on the energy use and the correlation between ventilation and the occupants' health and productivity were also considered. The review showed that ventilation is interrelated with many factors such as indoor and outdoor conditions, building characteristics, building application, as well as users' behavior. Thus, it is concluded that many factors must be taken into account for designing energy efficient and healthy ventilation systems. Moreover, it should be mentioned that utilizing hybrid ventilation in buildings integrated with suitable control strategies to adjust between mechanical and natural ventilation leads to considerable energy savings while an appropriate indoor air quality is maintained. So it's time for multiple choice questions. Number one, a professional heating, ventilation, and air conditioning technician is hired to perform the ventilation assessment of a newly established commercial building. Of the following air quality metrics, the most commonly used levels to evaluate the effectiveness of a ventilation system in a building would be of number one, A carbon dioxide, B volatile organic compounds, C particulate matter, D formaldehyde, and E nitrogen oxide.
A carbon dioxide.
Yes.
A.
Yes, the answer is A carbon dioxide. A patient with a highly infectious disease has been admitted to a hospital room. The most appropriate isolation ventilation system operating in the room to prevent the spread of airborne contaminants to other areas of the hospital may be A natural, B mixed mode, C mechanical, D underfloor air distribution, and E demand control. Anyone?
Mechanical.
Yes, the answer is C mechanical. A group of children is playing in the living room of a house for 2 hours. According to the recommended set of guidelines, the number of air changes to occur in the living room during the time the children are playing should be A3, B6, C9, D12, E15. So the answer is B6 because the children are playing for 2 hours, and 2 to 3 air changes should be present. A company is planning to move to a new office building and is considering the floor space requirements per person for the workspace. If the employer wants to minimize the space and allocate only the necessary minimum, the recommendation is A 1 to 50 square feet, B 50 to 100 square feet, C 100 to 150 square feet, D 150 to 200 square feet, and E 200 to 250 square feet.
B.
Yes, the answer is B 50 to 100 square feet. Number 5, an industrial facility XYZ is known to emit a large number of chemicals in the nearby residential area. In order to control indoor air quality, the Environmental Health Expert Committee recommends the installation of a complex type of ventilation system known as A natural, B exhaust, C mechanical, D supply, and E balanced.
Exhaust.
Yes, the answer is B exhaust. A team of scientists is working on a new drug development project that involves handling highly toxic chemicals and biological agents. In order to ensure the safety of the staff and the environment, the laboratory must be equipped with a type of ventilation system: A natural, B exhaust, C mechanical, C D supply, and E balanced.
B. Exhaust.
No, the answer is A natural. At the onset of the pandemic, patients diagnosed with worsening symptoms of COVID-19 were admitted to the hospital for treatment. As part of the hospital's protocol, the type of ventilation system typically used to control the spread of the disease had been A natural, B exhaust, C mechanical, D supply, and E balanced.
E. Exhaust.
No, the answer is C mechanical. An exhaust ventilation system is installed in the kitchen of a house. Of the following, the best description of the function of the exhaust ventilation system would be A to supply fresh air to the kitchen, B to circulate air within the kitchen, C to remove smoke from the kitchen, D to introduce heat to the kitchen, and E to humidify the kitchen air.
C.
Yes, the answer is C, to remove smoke from the kitchen. A building is equipped with a plenum ventilation system which utilizes the space above a drop ceiling to distribute air. Of the following, the most remarkable benefit of plenum ventilation systems is A, they require less maintenance, B, they can be easily modified, C, they provide more precise control, D, they are more energy efficient, and E, they are less expensive to install. So the answer is C. More,
C.
yes, the answer is C. They provide more precise control. Exhaust ventilation systems work by depressurizing the environment. Of the following scenarios, the most appropriate utilization of an exhaust ventilation system would be A commercial building with poor outdoor air quality, B, a laboratory with hazardous fumes and chemicals, C, a residential building with high humidity levels, D, a gymnasium with poor air circulation, and E, a hospital with high risk of infectious diseases, energy efficient.
C.
The answer is B, a laboratory with hazardous fumes and chemicals. So this is the key of the MCQs. Please subscribe our YouTube channel, and thank you very much.
Thank you very much, Dr. Ramsha. Very nice presentation. And the most important part is that you have highlighted the recent advances and how the COVID-19 that is very much linked with ventilation, air quality, and other important parameters. Another best thing of today's presentation is that all the postgraduate students, they are very well prepared and they have participated fully in MCQ session. And it gave me a very heartening feeling that all our postgraduate students, they are really interested in their own professional development and therefore academic progress. Very well done, all the postgraduate students, and especially Dr. Ramsha, and keep it up. Thank you very much. Allah Hafiz.
Thank you, ma'am. Allah Hafiz.